How's it going, everybody? If you've been to Total Performance before, odds are you may have seen something like these, which are cups that we use for our cupping therapy. Now, traditionally, these are used to help promote blood flow and healing, decrease pain by use of putting this on maybe an arm, stiff muscle, stiff joint, to help alleviate some of that pain. But there's some new evidence coming out that shows that using these actively and performing a movement or moving the cup itself may be more beneficial. So I'm going to take this opportunity to show you a couple different ways that we might be able to utilize this. All right, so now what? Okay, so I'm going to show you an example of a way to use this actively. I'm going to use my ankle because I have a history of ankle problems. So one way we can use this is to put the cup on a muscle or on an area where there's a couple muscles or some tight fascia, or just a joint restriction, right? So if you can narrow down where that's coming from, you can use that on that area. All I'm gonna do is I'm gonna pump about 2 times, right? Sometimes less is more, okay? Because I don't want it to hurt too bad, all right? But I'm gonna do that, and I'm gonna do some inversion, so I'm turning my foot in, and eversion, where I'm turning my foot out. Now, the area that I've put this cup on is on my everters, right? So they are gonna turn my foot out, right? So that's gonna make that motion feel a little bit challenging, but what that's gonna do is that's gonna promote even more blood flow, and that's gonna help improve my range of motion and my tolerance for that exercise. One of the ways it does that is it improves the shearing forces along that fascia component that separates the layers of muscle and tissue. It helps that slide and glide component over there, and it helps decrease some of that densification of that area. If it's feeling a little sticky, if it doesn't want to do it, if it doesn't feel too pleasant, it helps kind of improve the motion between the tissues in that layer. And so something I might do is I'm going to kind of do this for one set, maybe of 10. Okay, I'm kind of going both ways. I'm going in and I'm pushing out. I'm getting a stretch and I'm getting a contraction of those muscles. And that gets a little bit sore and a little bit discomfort, but not too bad. And the other thing I can do is now I'll take this off, put it off to the side, and now I can do that, and that feels a lot looser and a lot more comfortable for me to do. And now my willingness to do that exercise, to move my ankle through a range of motion, feels a lot more improved. Now that's just one example of how to use those cups at home. There's a couple different ways we can use that. You can use that for anti-inflammation, really low pressure, moving it along the joint surface or around the area that's inflamed. The other ways you can use that are, like we said, statically for pain, actively how I used it. But in general, you want to go by a couple guidelines. You don't want to go any more than 10 minutes. 5 to 10 minutes is what this research suggests is the most powerful. You want to go low pressure, right? You don't want to be increasing your pain. Part of the reason we're doing this is to decrease your pain and increase range of motion or improve the stiffness, flexibility of something. So you don't want it to be causing too much pain. So if there's any ever questions about anything, please feel free to come in or to call us and talk to us here at Total Performance, and we can walk you through just how you might be able to find success using these cups at home.